Hi, so today I'm going to talk to you about one topic which often is brought up by a lot of patients and a lot of other people who are taking or wanting to take homeopathy, is that why do homeopathic doctors don't tell the name of the medicine? Now, you have to understand that homeopathic medicines are given on a very deep understanding about the patient. So, what I mean by this is that we consider all the physical symptoms, we consider the mental, emotional aspects, the environmental factors that are affecting the patient, and we also consider the diagnosis of the patient. It is a misconception that homeopaths don't believe in diagnosis or that homeopaths don't do investigations and all that. We consider all these factors and we make a prescription or we come to a prescription. So, for example, when we are talking about, let's say, depression or diabetes, which is the diagnostic label given to a certain set of symptoms, or let's say hormonal imbalance, then these kind of labels will also tell you that there is a common set of symptoms because of which we have given this diagnostic label. For example, feeling low, having some fear, lack of interest in the present situation could be common symptoms of depression, while increased in thirst and increased in the frequency of urine, etc., can be common symptoms of diabetes. And irregular menses or excessive bleeding during menses, etc., can be common symptoms of a woman who comes with hormonal imbalance. Okay, so homeopathy goes much deeper beyond these symptoms and tries to understand the impact of depression or the diabetes or hormonal imbalance that the patient is going through. What could have triggered that problem? How does that problem affect that person on a day to day basis? Having diabetes or having depression or certain changes within the mental framework of the patient, how does that affect that individual on a day to day basis? How does the surrounding affect him? All these things are considered, and then based on that, we select the best possible medicine to suit all these symptoms. So when we give that prescription, and if we tell the name, while most of the data about the medicine is available in our source books and also on the internet, etc., the main thing I want everyone to understand here is that homeopathic medicines are actually proven on healthy human beings. So the data that is available from the healthy provers is very authentic, and we have this in our source books. So many times these source books give you the data, but at times the doctors can also be selecting a medicine or using a medicine based on their clinical experience. Now, certain clinical experiences may not be found on the internet, or in the Google search. So, if somebody tries to search for data and if he doesn't find corresponding data on the net, this could be very confusing. In such situations, if we give the name of the medicine and the patient tries to search for it and he doesn't find it on Google, it can further confuse the patient. Or there are situations where we see that certain medicines are prepared from certain toxic substances. For example, arsenic alb is one substance from which medicine is produced, or from snake venom, etc. But the moment the patient finds that this has been used for the medicine without understanding the entire process of how the medicine is actually prepared, this can confuse him to think that he is taking actually the poison or maybe the toxic substance and all that, which is not true. Then secondly, the power of the medicine and the repetition is to be determined on the basis of response. So when I give a medicine for a particular condition, I always look for the response from the patient. How is the patient responding? Whether the symptoms are going down, or whether some new symptoms are coming, or what is happening in that case. On the basis of this, we decide what power of the medicine and how much repetition, etc., has to be done. So that is why we discourage our patients to generally buy the medicines over the counter and to avoid self medication, etc., because this may not be best in the interest of the patient. So